Welcome to a critical comparison of two serious medical conditions, epidural versus subdural hematomas. Understanding the key differences is vital for rapid diagnosis and treatment. These conditions involve a collection of blood within the skull, putting dangerous pressure on the brain tissue. Let's start with the epidural hematoma, often considered the more acutely life-threatening injury. An EDH collects blood between the inner surface of the skull and the dura mater. It's usually associated with a traumatic skull fracture. The typical source of bleeding for an EDH is the middle meningeal artery. Because this is an arterial bleed, blood accumulates rapidly, causing swift deterioration. The classic sign of EDH is the lucid interval. The patient loses consciousness, wakes up appearing fine, and then quickly deteriorates as the hematoma grows. On a CT scan, an epidural hematoma appears characteristically biconvex or lens-shaped. Crucially, it does not cross the rigid suture lines of the skull. Next, let's examine the subdural hematoma, which has a different presentation and bleeding source. A subdural hematoma is a collection of blood between the dura mater and the arachnoid mater. It's often caused by sudden acceleration or deceleration injuries, like falls or accidents. The source of bleeding for an SDH is typically the bridging veins, which are torn by the movement of the brain. As this is a venous bleed, the blood accumulation is often slower. SDHs are classified by the timeline of symptom onset. Acute SDH symptoms appear quickly, while chronic SDH develops over weeks and is common in the elderly or those with brain atrophy. The subdural hematoma has a distinct crescent or moon shape on a CT scan. Unlike EDH, it can cross suture lines, but it stops at the midline. To summarize the differences, EDH involves an artery, leading to rapid bleeding, while SDH involves veins, resulting in slower progression. The shape on imaging is another key differentiator. Epidural is biconvex or lens-shaped, and subdural is crescent or moon-shaped. Remember, EDH is limited by the skull's sutures and cannot cross them, whereas SDH can cross sutures but respects the brain's midline. Both conditions are medical emergencies. Significant hematomas require surgical evacuation, typically via craniotomy or burr holes, to relieve dangerous intracranial pressure. Understanding these critical distinctions is essential for anyone in the medical field dealing with head trauma. Thank you for watching.